all started quietly in December 2019 in a city called Wuhan, China. Life was normal, bustling with people shopping and eating out until a cluster of pneumonia cases appeared. Doctors were puzzled. This wasn't the flu, SARS, or anything they had seen before. Soon the culprit was identified, a new coronavirus later named SARS-CoV-2. By January 2020, the virus started spreading beyond Wuhan, jumping borders with travelers. The World Health Organization, WHO, declared it a public health emergency of international concern. Yet many of us continued with our lives, unaware that the world was about to change. Then came March 2020, a month that will forever be remembered. COVID-19, as the disease caused by the virus was named, was officially declared a global pandemic. Overnight, cities went silent, streets emptied, airports closed, offices, schools, and restaurants shut their doors. Words like lockdown, quarantine, and social distancing became part of everyday conversations. At first, many thought it would be over in weeks, but weeks turned into months. The virus spread like wildfire, overwhelming hospitals. Doctors and nurses worked around the clock, often without enough protective gear. Families couldn't visit their sick loved ones, and millions mourned alone. Globally, leaders scrambled to respond. Some countries managed better than others, but everywhere, people's lives were disrupted. Jobs were lost. Resilience and recovery. Lessons from the COVID-19 pandemic. Economies stumbled, and mental health crises deepened. Yet even in the darkest times, there were glimpses of hope. Neighbors helping neighbors, people applauding healthcare workers, and scientists working tirelessly to find a solution. That solution came faster than anyone expected. By December 2020, vaccines began rolling out, an incredible achievement in medical science. Slowly, people started getting vaccinated, bringing hope that life could return to normal. But the fight wasn't over. New variants emerged, Delta, Omicron, each more contagious than the last. Vaccines helped reduce severe cases and deaths, but the virus continued to evolve. Many countries faced waves of infections, balancing between reopening and imposing new restrictions. 3 years later, the world looks different. Masks are still common in some places, while others have moved on entirely. Economies are recovering, but scars remain. Millions of lives lost, businesses shuttered, and a generation that grew up in isolation. Yet the pandemic taught us resilience. It showed us how connected we are. Scientists shared data across borders, communities came together to support one another, and individuals discovered strength they didn't know they had. COVID-19 didn't just change the world, it changed us. And as we look ahead, one thing is clear: humanity can endure, adapt, and rebuild, no matter the challenge.